Okay. Are y'all there or am I frozen?
No, we're here.
Okay, sweet. So yes, vocab test. I will say let's do vocab test every Thursday and specialist test every Wednesday. Okay. And I will give you your new set of vocab words on Monday. It will say new vocab words, you know, 16 through whatever, or you know what I mean. So, okay, awesome. And then just have someone read them, read the words out, and then you write the definition.
Do they have to be in order when they read them out?
Yeah.
Okay.
So, yeah, if it's 1 through 22, number 1 would be dentist.
Okay.
Yes, please. Thank you. Good question. All right. Any other questions?
I had one. I think I messaged you yesterday on like questions that we missed on the worksheet. Is there a way that we can know what we missed, like in the workbook?
And I was thinking about that as well. It's very hard for me to go back and do that unless after lecture I can basically after lecture, and I know your homework is already in and I've graded it, then I can go back and I can kind of grade it out loud, and y'all can get your book and mark which ones you got wrong.
Okay.
That would be the easiest way for me to do it.
Okay. I just want to make sure, like, on any questions I missed, that I know the right answer.
Right. Correct. Yeah. Correct. So we can do that. In fact, after we go over chapter 3, I can get out the grade book and I'll grade out loud chapter 1 and 2 since y'all have already done it and your grades are in. Will that work for y'all? Okay, good. And then someone did message me about Quizlet. So on Quizlet, you would put in Google Quizlet, and then you would put in dental state board or state board of dental examiner practice test for state board for dental, and it should there'll be one for radiology, one for jurisprudence, excuse me, and then one for infection control.
Okay.
So.
And then you said, so we have the vocab test every Wednesday and the specialist test every Thursday?
No, backwards. So specialist test every Wednesday.
Okay.
Vocab every Thursday.
Okay. Got it.
Okay. I need a dust. That's why I'm coughing. Okay. So, all right. Well, let's get in. Did any other questions? No. Okay. Well, let's get into chapter 3, and then after we do chapter 3, I'll have to get up and go get my book so I can come back and tell you those questions. All right, here we go. Anatomy. So everybody got highlighted? Got your highlighters? Okay. Anatomy, a study of the structure of the human body. So anatomy, we all know that boys and girls are shaped different. That's our anatomy. Okay. Physiology is the study of how the human body actually functions. Like physical ed in high school or elementary, PE, physical ed. So how the body moves, right? So physiology is the study of how the body actually functions. All right. Go over to page 21 where you see the little girl. All right, so it's showing how how her body is divided up, okay? And so the sagittal plane refers to the lengthwise cut that divides the body into right and left portions. If the cut passes through the midline of the body, then it's called mid-sagittal. So one thing that our major thing is we need to know that this is our midline, okay? This is our midline. And then the frontal plane divides the body into anterior and posterior. So where's our anterior part of our body? Caitlin? Where's the anterior part of our body?
Toward the front of the body.
Yep,
Front
and
of
our
it.
posterior, Brissa? Where's the posterior part of our body? Remember yesterday I was talking about posterior, your derriere? It's
Yep.
in the back. The posterior is the back. Okay, good. All right. The human body has 4 organization levels or units. From the simplest to the most complex, they include cells, tissue, organs, and body systems. So cells, cells are the smallest unit in the human body. Approximately 75 to 100 trillion cells join together to form special groups known as tissue. So tissue, there's 4 different types of tissue. You have epithelial, which is your skin. You have connective. And so if you turn the page, it breaks it down for you. Turn to page 222, types of tissue. So epithelial, like I said, is going to be your skin, your intestines, your lungs, reproductive system, lining of the oral cavity. Your connective binds structures together, forms the framework, and supports the organs of the entire body. Fats, tendons, ligament, blood, bone, cartilage. And then you have muscle, produces movement of the body. Your heart, your digestive system, those are muscles. And then, some people have bigger muscles than others. Nervous is found in the brain, spinal cord, and nerves. And we know, if we touch something hot, we're like, oh, that's hot. So our nervous system works to stimulate muscle contraction. Creates awareness of the environment. Like today, my nervous system is going to tell me it's going to be hot outside. It is going to be hot. All right, systems of the body. There's 11 systems of the body, major systems of the human body. So if you go over to 23, page 23, it lists all 11 and what they do. So skeleton, 206 bones make up our body. Muscular, cardiovascular, that's our heart, and veins, arteries. Lymphatic and immune, our white blood cells, our spleen, our tonsils. Nervous is going to be your nervous system. I'm sorry. Digestive system, mouth, larynx, stomach, intestines. Urinary, kidneys, urethra, bladder. integumentary system, sorry, skin, hair, nails, sweat glands. Endocrine system is pancreas, thyroid, and many more. You see them next to it. And then reproductive system. Reproductive, male and female baby making parts. So, yeah. We know what those are, right? Okay, I don't have to go into detail. Okay. All right, so that's your 11. All right. Go to page 25. All right, there's 2 different types of bone that make up the jawbone, okay? So, Caitlin, what's our upper jaw called?
Is it maxilla?
Maxilla. Perfect.
Maxilla.
Maxilla. Maxilla. And then, Lindsay, what's our lower jaw called?
The mandible.
The mandible. Perfect. So, the maxilla is actually made up of compact bone, also known as cortical bone. It is hard, dense, and very strong. Oh, I'm sorry. The compact bone, did I say maxilla? I meant mandible. So your mandible is made up of compact bone. Okay? If you see it on this x-ray down at the bottom, it's solid white where the arrows are pointing. So like if someone hits you, hopefully it doesn't break. But then your maxilla is made up of cancellous bone, also known as spongy bone. It looks like a sponge. If you see on the bottom of 25 with the arrows pointing on picture B, see how it looks kind of spongy? That's known as cancellous bone. And that would be for your maxilla. All right. The cranium forms the bony protection for the brain. So, your cranium. TMJ, I have a awesome video for y'all to watch on YouTube today over TMJ. What TMJ is do y'all ever open and close and your jaw pops? Like if you put your fingers right here and you open and close and it pops?
Yes.
Mine does. That's where your TMJ joint is, your temporal mandible joint, okay? And there's a little disc in there, and it's known as your articulate disc. And it can kind of wear thin or come out of place, and that's what causes that popping sound. So like I said, I put a really cool video on YouTube for y'all to watch. I could talk about it, but y'all actually getting a visual and understanding what TMJ is, this video tells you exactly. So now people that do have issues with TMJ would go to the dentist, and the dentist would take an impression and make a night guard. It's a plastic piece that they wear in their mouth at night, and it helps with the clenching and grinding to take the pressure off of that joint. Some people are good about wearing it. Some people, they just spit it out in the middle of the night. Insurance picks up a little bit of it. It's typically about $300, $400. But if the night guard doesn't work and they still have severe issues, they can actually have TMJ surgery. And if you wanted to watch on YouTube a surgery of what the TMJ, it's this long needle, and they go in here, go through the face. Kind of wild looking. So if y'all wanted to watch that video, it's pretty cool. All right. The hinge action. So now I'm on page 28. The hinge action is the first phase in opening the mouth. Gliding is the second phase of opening the mouth. So you can tell that your jaw kind of slides forward. I turn the page. Any questions so far? No? I know this isn't really exciting, but when we get into chapter 4 is pretty fun. We get into the anatomy of the tooth, and it's pretty fun.
Is a lot of chapter 3 on the same?
Oh, Vanessa, I couldn't hear you, baby.
Oh, is a lot of chapter 3 on the state board exam?
Oh boy, say that
On
one.
the state board exam.
What?
Chapter 3. Is it on the state board exam?
No.
A lot of it. No.
No. No. Not at all. But we need to know this stuff. So, arteries carry oxygenated blood away from the heart to all parts of the body with a pulsing motion. Veins carry blood back to the heart. I always get those confused. No, but in the dental office, when the doctor's talking to the patient, and he's like, "Oh, well, your trigeminal nerve or your TMJ," and things like that, you'll know what they're talking about. So that's why it's important that we do know the anatomy of the jaw. All right. Nerve supply to the mouth. So the major nerve supply to the mouth is your trigeminal nerve. And if you notice on page 33, it's purple. Do y'all see that? On page 33 where it's purple? That's your trigeminal nerve. So it is the fifth cranial nerve. It is the primary source of the nerve supply to the mouth. Innervation is another term for nerve supply. So if you ever hear innervation, it's another term for nerve supply. The trigeminal nerve divides the maxillary and mandible branches to serve the mouth. So when it comes time for him to numb the patient, he needs to know where certain nerves are to numb. Now, do we need to get so precise? No, because we're not numbing. No, we need him to know. But we don't need to know the exact nerve that he's about to stick the needle in. So, but we do need to know that this is our trigeminal nerve, the main nerve supply to the face, or to the mandible and the maxilla. All right, a foramen. So if you, let's see if there is a picture. I don't think there is. There is not. If you looked at a skull, actually there is. Y'all turn back to page 26. Down at the bottom, figure 3/7. Do you see the two holes in the mandible and in the maxilla?
Mm-hmm.
Those are your foramens. So what your foramen does is it's an opening in the bone through which the blood vessels and nerves and ligaments pass through to the face. So you have, and they're right by your premolars. So you have 2 here and 2 here. Now, of course, if you lift your lip and tried to see them, you couldn't see them. You can only, if you had a skull, you could see them. So that is your foramen. You have 4 of them. And what does the foramen do? I'm sorry. It's the opening through which blood vessels, nerves, and ligaments pass through to the face. All right, turn the page to page 34. We're going to talk about some features of the face. So on number 4, philtrum. Do y'all see that? Where it says features of the face on page 34.
Mm-hmm.
Okay. So your philtrum is this thing right here on your upper lip. Some people call it an angel's kiss. I think it looks like a candy corn, like the shape of a candy corn. But that's your philtrum. How I remember that's your philtrum is Dr. Phil has a mustache right there. Philtrum. That's how I remember that's what your philtrum is. Does anybody have their tragus pierced in your ear? You know that little bone right there? That's your tragus. Some people get it pierced for migraines. Your number 11, your mental protuberance, part of the mandible that forms the chin. Some people have a really dominant one. Have y'all ever seen Jay Leno? I don't know if y'all know who he is. He has a big protuberance. I'm sorry. And then have y'all ever gone to like Six Flags and they have that cartoon artist and your chin's like,
Yeah.
the state fair? Yeah. Mental protuberance. And then your zygomatic arch is the prominence of the cheek. So your cheekbone. Or cheekbones. Zygomatic arch. All right. Now we're going to talk about tongue. Your tongue. The tongue is one of the body's most versatile organs and is responsible for a number of functions. Speaking, positioning food while eating, tasting, sensation, swallowing, and cleansing the oral cavity. So the top of your tongue is known as your dorsum. Okay. And I think in your binder, I gave you, it was a cute little handout, not a cute little handout, but an informational handout. It was a picture of a tongue and it told you on your tongue, like if you ate something salty, where on your tongue does that pick up? Or you taste at the front would be sweets, sours. So kind of interesting. And then, so our tongue too, and I'm going to have y'all look up some things on your phone. So do y'all have your phone handy? There are sometimes things that you're going to see on the tongue. Okay. This is why I want you to look up right now 2 things. First, I want you to look up geographic tongue. Geographic tongue.
That looks horrible.
Oh wow.
So it can, I mean, it's not uncommon, but it's not common. So maybe 1 out of 20 people might have it. You know, it's not real common. But it's not contagious. It's something that they were just born with. Something they were just born with. And and why they call it a geographic tongue is because say they wake up and in the morning they have a spot on the tip of their tongue. By the end of the day, the spot will have moved to the back of the tongue. So the spot moves. It can move to the left, to the right, throughout the day. And
Are
so,
they painful?
huh?
Are they painful?
The one that looks like hamburger meat, unfortunately, I mean, you would think that it would be painful, but it's not.
Can
Yeah.
it go away?
No. Nope. If you have a geographic tongue, you just have a geographic tongue. Yep. You were just, that's how God created you. Yeah. So, but that's why they call it a geographic tongue because it moves around kind of like a globe of the world. So, geographic tongue. Now I want you to look up hairy tongue.
What kind of tongue?
You said Harry?
Hairy, girl, hairy.
Ew.
What?
People
That's
actually have that?
disgusting.
Yep. Yep. It is a thing. It is a thing. So now I want you to Google what creates what causes hairy tongue and how does someone treat hairy tongue? And that might be something that I would like for y'all to actually, on a notebook piece of paper, guys, if you can write down hairy tongue, what causes hairy tongue, and how is it treated? And just write a little thing to me and scan it in, okay? So it can be treated. It can be treated. So, and then y'all will let me know how it's treated. Okay. All right. And I was talking about when the doctor numbs the patient up. That tongue, when you're suctioning, and I'm going to show you how to suction because that tongue is numb. And it's like trying to play tug of war, trying to get that tongue out of the way when you're suctioning. But when we get up in the clinic, I will show you how to do all that fun stuff. All right. Page 36. Frenum. A frenum is a narrow band of tissue that connects two structures. Two structures. So we have 3 frenums in our mouth. Okay. Under your tongue, that narrow band of tissue under your tongue. If you lift up your upper lip, you've got that narrow band. There's your second frenum. And then your third frenum is pull your bottom lip down, and it's that narrow piece of tissue right there. So you have 3 frenums. Here, here, and under your tongue. Now, some people have to have what's called a frenectomy, and that's where they actually snip that tissue. So, have y'all ever heard of someone that's tongue-tied and they talk like this and they really can't talk good because they can't move their tongue very well? So they would go underneath the tongue and they would do a frenectomy and snip the frenum, and then that gives more leeway for the tongue to move.
So why would they need a cut?
What?
Why would you need to have that cut?
Because the tongue can't move.
Mhm.
It's too tight. It's too like
For
I
some
can lift
people,
my
it's too
tongue all the
tight.
way and touch the roof of my mouth. And people that if they're frenum, if it's too the tissue is too tight, the band is too tight there, they can't do that and they can't actually speak correctly. So they have to snip it, and then it makes them where they're able to use their tongue better to speak. Did that answer your question?
Yes.
Okay. All right. Okay, good. Hard palate and soft palate. So your hard palate, lift your tongue, that's the roof of your mouth. If you go back towards your uvula, your little hangy thing, that's your soft palate. Hard and soft palate. Gag reflex. Who gags when they brush their teeth? Yeah. So gag reflex is an involuntary protection mechanism located in the posterior region of the mouth. This is very sensitive area, includes the soft palate, the uvula, and the surrounding tissues, and the posterior portion of the tongue. Now, you will get some patients that are really bad gaggers. So when we have to take an impression or an x-ray, I will show you little tips to help them not gag. Now, sometimes when that gagging starts, that's it. They can't stop. They're like, ugh, ugh. Yeah. But telling someone to breathe through their nose helps stop the gagging. But sometimes it does not. So, all right. Alveolar process. That is a fancy word for jawbone. Alveolar process. Fancy word for jawbone. The teeth are firmly held in place with the bone of the alveolar process. Your alveolar crest. Let me see. Is there a picture? Yes. If you turn to page 38, there's an x-ray. Do y'all see that picture of an x-ray? That's actually known as a bite wing x-ray, a type of x-ray that we take on patients. And it shows both the mandible and the maxilla together, where the teeth come together on one film. But do you see where the arrows are pointing? That's the bone level. That's the alveolar crest. So if someone had gum disease and periodontal disease and they had bone loss, the bone would be higher up. Because remember, yesterday I said, okay, pretend this is the crown of the tooth. This is my root. Right here is the CJ. So right here is where the bone level should be. But if someone has gum disease, periodontal disease, the bone, the bacteria starts eating away at the bone and it starts going down. The alveolar crest can be way down here. And at that point, this tooth is like flapping in the wind. I mean, they sneeze and it's a goner. So, yeah. So that's your alveolar crest. And then you have your alveolar socket. Have y'all ever seen a little baby, or not a baby, but a 5 or 6-year-old loses a tooth and they've got a hole where the tooth was? That's the alveolar socket. The alveolar socket is where the actual tooth fits into the bone. And then you have your oral mucosa. It's the lining of your mouth. The lining of your mouth is your oral mucosa. You also have a masticory mucosa, and that's going to be around the teeth. and it's a little firmer tissue, tougher tissue. That way, when we eat things like chips or anything, our gums aren't like getting torn up, or it doesn't hurt our gums when we eat. So a fancy word for gums is Vanessa. Do you remember what a fancy word for gums is?
Gingiva or something?
Huh?
Gingiva? I don't know how to pronounce it.
Gingiva.
Gingiva.
Gingiva. Gingiva is a fancy word for gums. Yes. Okay. Good, good, good. All right. Charlie, go away. Sorry. All right. Well, that is chapter 3, guys. And I am going to go and get the grade book. So go ahead and get out your workbook and your book and turn to chapter 1. And then I'll go through the grades and you can see which ones you missed, okay? I'll be back.
Sorry about that, guys. I just hate not knowing if I missed and what I missed.
No, yeah, I mean, I was wondering the same thing.
Yeah, no, that's fine. That's fine.
It's hard not being in person in classes.
It is hard.
Because we would have graded together in class. Yeah, we would have graded together in class. So, all right. I'm just going to, go through these. So, here we go. One is C. And I'm sorry, guys.
Are you in the book?
I
Are you
am
in the
in the book. I'm in the
Okay.
book on exercises. Yes, the
Okay.
10 questions. All right, here we go. 1 is C, 2 is C, 3 is D, 4 is C, 5 is B, 6 is A, 7 is C, 8 is C, 9 is A, 10 is A. Now, turn to chapter 2 since we're already in here. All right, 1 is A, 2 is B, 3 is C, 4 is B, 5 is A, 6 is B, 7 is B, 8 is A, 9 is C, 10 is B. Okay. Now we're going to go to chapter 1 in your workbook. One is true, 2 is true, 3 is false, 4 is false, 5 is true, 6 is false, 7 is false. It's Kells, not Wells. All right. And then y'all listed dentist, dental assistant, dental hygienist, business assistant, dental laboratory technician, dental public health, endodontist, oral and maxillofacial radiology, oral and maxillofacial surgery, oral pathology, orthodontics, pediatric dentistry, periodontics, prosthodontics. 22, reception area where patients are received and greeted. Business office for management of business side of practice. Other non-clinical areas such as consultation room where the dentist discusses treatment plans. Centralized sterilization, dental laboratory, and treatment rooms. Now, fill in the blank. 28, oral and maxillofacial surgery, periodontics, orthodontics, dental public health, pediatric dentistry, endodontics, oral pathology, prosthodontics. Okay, now let's go to chapter 2. Any questions? Did I go too fast? Did anybody need? All right. List 3 steps for good risk management. Maintain accurate and complete records. Gain informed consent. Maintain high standard of clinical excellence. Did anybody have anything different?
I put that.
Okay. List 3 essential aspects of professional appearance. Good grooming, good health, appropriate dress. Did anybody have anything different? Okay. And then, 4 personalities of a good dental assistant. Be sensitive to the needs of patients. Show empathy. Say the right thing at the right time. Be sincere. Build a good rapport. All right. 11 is direct supervision. 12 is ethics. 13 is EPA, Environmental Protection Agency. Now, 14, guys, it was very confusing. So if you put OSAP, it's okay. But if you put CDC, it's okay. I need to go back and look. I didn't bring the workbook home. So I will have to double check on that. But I gave you points anyway. Okay? So 15, FDA. Because in the book, and the reason why I say this, in the book, in the grade book, it says OSAP, but I have a line through it and I have CDC next to it. So I don't know why I did that. So that's why I said I'm going to take both and then I'll research why I did that. 15 is FDA. 16 is indirect supervision, or also known as general supervision. And then 17 is OSHA, Occupational Safety and Health Administration. And 18 is Regeste. 19 is D. 20 is D. 21 is A. And 22 is D. And also, too, guys, so, like I said, because I know that y'all want to know what you missed and you want to put the correct answer. I understand that. And so we'll do this, but we'll only do it after all homework is in for that chapter. And then I'll go over, I'll grade it, tell you what the correct answers are after all grades are in for that chapter. You did. All right. Any questions? Oh, we won't see each other till Monday. I'm so sad.
So, in the workbook, we do chapter 3.
Yep. So today's homework is chapter 3 in your book, the 10 questions at the end of the chapter, and your workbook.
And then in chapter 3, there was a page where you said don't do, so we still don't do that one.
Yeah, I said I'd omit the skull.
Yeah.
Yeah.
And then there's a page right after that. Do we do that one? Or?
You do that one.
Okay.
Only thing you're omitting is the skull
one. Okay.
Mhm. And if you could please get me all your homework by today. The latest I'll take it is tomorrow. Okay. And Jasmine, when you watch this, I need your homework. Okay. For chapter 2. And remember too that test starting next week, if it's opened, if chapter 4 is open next Monday, that's it. You have until Monday to take that test. Okay? It gives you all day. If for some reason, I mean, if there is something, let me know, but text me personally. Okay?
And do we have chapter 3 test today?
You do?
Yes.
Okay.
Yep. You have chapter 3 test today.
And vocab.
And vocab and specialist test today. Yes. Specialist test today, vocab test today, and then your chapter 3 test and your chapter 3 homework. Okay? And then Monday, I'll give you new vocab words for the week. We already went over every single vocab word yesterday. And so I'll just give you the numbers of what the new test is going to be. I think it's 23 through something. And then your vocab test then would be next Thursday. So from your new words you get on Monday, that vocab test will be Thursday. But your specialist test would be Wednesday. Every Wednesday over the same 9 specialists. Wednesday. Okay.